One of the biggest differences about Calo is the parent involvement. And you're involved in family therapy, and it is true family therapy, but beyond that, Calo asks you to come to Lake of the Ozarks, to come to their facility. And it's not a facility, I mean, it is a home atmosphere where you are able to sit down with everybody. You're able to sit down with your son or daughter, in our case with our son, with his coaches. And the other really neat thing that Calo does is the fact that they're able to get families together. We have family retreats with Calo every fall and every spring. And what they do at those retreats is, again, they bring families together. They bring you and put you kind of out of your element. Everybody gets a little bit uncomfortable maybe, but you learn something about yourself. You learn something about your family. And the other thing is that they have support groups where you're able to sit around and talk and say, wow, that happened to you? Because that happened to me too. Or, wow, I thought my situation was bad, but, here's somebody else that's got something that's even more challenging. And you find, different people that are on different paths and different points along the path. And, somebody who, like when we first started, I think our son had been there just 3 or 4 weeks and we went to the first parent retreat. Well, we were brand new to this, but we'd had plenty of experiences, and some other folks, their kids were getting ready to graduate. And so you're able to really support each other along the way. And I just can't say enough about the support that the family gets through all the different activities that Calo provides.
So one of the invitations that we have for our parents is that we just ask parents, please open your home, and if we as Calo staff, and especially the therapist, can come inside your home and help you co-parent, we really feel like we can help you be even a better parent. We don't want to take away from all the great things that you're doing. In fact, we just want to take all those great things and just add to it. And what we ask in return is that our parents then come to Calo and say, hey, we want you to do co-therapy with us here at Calo. So together with us being co-parents with you and co-therapists together, we feel like we can bring about the lasting change that we're after. Throughout treatment then, we actually are making sure that our parents are involved in social calls every week, that there's co-therapy sessions that they're participating in. Usually that's done through the phone or through Skype. And so that there's still that interaction and that personal feel, so there's not a disconnect. Sometimes parents will say, well, that seems kind of counterintuitive to take my child to residential treatment if I'm trying to work on attachment or trauma. And we would just say, frankly, it is. But there has to be such a disturbance in home that you would actually feel like you need the level of residential treatment. So we just ask that our parents are there every week for therapy, that they're there every week for social calls, that they're participating in activities on our campus, that every couple months that they're on our campus, that they're learning about the culture here at Calo, our milieu, how our coaches coach our students so that they can take those things home with them as well, things of that nature. Because the family system, viewing the family system is so critical, we have to see the student existing within a context of a family. So sometimes it's easy to get lost in, oh, here's Johnny and he's at Calo and we're going to help him, but that actually would be counterproductive for his long-term health. We have to see him existing within a family and in a community. And of course that family's been through a lot of their own loss, and there's been disruptions and there's been grief. And a lot of times the parents are really struggling to trust the child again. And so that work is also not just on the aspect of helping the student, but it's actually really aimed at helping the parents know how they can have forgiveness, that they can have healing, that they can have peace, that they can have understanding, because a lot of times our parents feel like they're on an island, that no one can understand them. And so when they come here, they feel like there's some understanding, but also validation, that wow, actually people understand this. And even some normalization, that wow, there's actually other parents going through the same experience that I am, and I'm not alone. Actually, people understand me. And so that's a piece of it, but also giving them skills and tools that they really feel like, boy, that's something I can do at home. I can take that and I can do that with my child at home. And so the experiential component, not just the education, but the experiential component is really, really valuable. So a few years ago, actually just shortly after we opened, we recognized that our parents were wanting more, that family therapy is great. Coming to our campus and learning about our schedule and our milieu was really helpful. But what they were really after is, hey, give us some skills and tools that we could actually have to take home. And so we started doing parent seminars and parent retreats. They're both semi-annual. Our parent retreats are every spring and every fall, where our parents come from all over the country. And we usually have really great attendance. And we start usually here on campus with some training, some education to set the stage for what the retreat experience will be like. But then we actually go and have experiences off campus, usually at a camp or a retreat location, and really try to drive home the very principles that our parents were educated about to begin the retreat. And so we'll go do aquatic activities. We'll have a mask activity where the parents and the student alike are having to talk about what those things mean. Instead of just some insight, they're actually having to go through these experiences together where there's trust, there's ropes course, there's recreation therapy challenges that kind of push them outside of their comfort zone a lot of times, and it helps our parents and our students connect in a great way. Our seminars are similar. They're semi-annual, and they are every summer and every winter. They are a toned-down version of our retreats. They're actually just here on campus. They go to our conference room and they get some training, but also some experiences where we'll actually sit and we'll practice listening, we'll practice talking, we'll practice just some of these therapeutic opportunities that they think they're getting, but they're maybe not practicing enough. In addition to the education and the insights and the skills and the tools and the experiences, there's also opportunities for our parents to connect, and that's a huge piece of it. Our parents really feel like they're on an island most of the time and that they're alone. And most of the advice from outside people is, you need to do more behavioral this or behavioral that. And these retreats provide the opportunity for our parents to sit down together, have some support groups, have some understanding, and so that they are able to feel really normalized and validated of, wow, I'm actually going through stress and heartache, but actually a lot of other parents are too. That doesn't bring me joy, it brings me the feeling of that I'm normal, that it's actually okay, that I could actually work through this. And so that piece alone was enough for us to start our retreats. But on top of that, we wanted to give some skills and education and training.